members of the committee for your leadership efforts to address the fatally flawed Medicare physician payment formula called the Sustainable Growth Rate, the SGR. Due to fundamental defects of the SGR, a 10.6% cut in Medicare physician payment rates is scheduled for July 1. And on top of that, another cut of 5% is projected for January 1, 2009. And even more cuts through 2016, totaling 40%, during a time that physician practice costs will increase nearly 20%, and that's according to the government's own conservative estimates. Since 2002, the physician community has had to work with Congress each year to achieve 11th hour interventions to ward off steep payment cuts and preserve patients' access to care. Moreover, Congress has used a financing mechanism in the last two legislative interventions that has resulted in deeper projected cuts for each subsequent year, making each year's legislative fix more costly than the previous one. Let's don't repeat this cycle. We urge committee members and Congress to take immediate action to avert the July 1 physician payment cut, replace it with 18 months of positive updates that do not increase the size or duration of cuts that must be fixed in future years. If Congress allows the projected cuts to go into effect, this could adversely impact millions of patients, physicians, and individuals employed by physicians' offices and related businesses across the country. An 18-month fix will allow time to implement a new physician payment system that reflects increases in medical practice costs. This, we think, is especially important as the baby boomers begin enrolling in 2011. A stable system, consistent with the goals of the Medicare program, is needed to ensure the promise of high-quality health care to beneficiaries. The SGR undermines the Medicare program. First, patient access will be impaired if the projected cuts go into effect. The vast majority of physician practices are small businesses. In fact, 50% of physician practices have less than 5 physicians, and they account for 80% of outpatient visits. Physician practices, as small businesses, cannot absorb the steep losses projected under the SGR. No small business could survive under a business model that dictates steep cuts year after year. In fact, in an AMA survey, 60% of responding physicians said they would have to limit the number of new Medicare patients they will treat if this year's pay cut is not stopped. And the SGR will exacerbate physician shortages. We are predicting a shortage of 85,000 physicians by year 2020 without any of these cuts. And we know that physician pay cuts will force many practicing physicians over the age of 55 to await early retirement, exacerbating the shortage. This will impact all patients, not just those in Medicare. In addition, the SGR is incompatible with physician adoption of health information technology and quality improvement initiatives. The reason is that quality initiatives, which rely on the use of health information technology, result in greater utilization of physician services, including aggressive strategies to manage chronic diseases that increase physician visits, imaging, lab tests, and drug therapies. This can reduce more expensive hospital admissions on a Medicare Part A, but it increases spending under the SGR, Medicare Part B, leading to additional payment cuts for physicians. And the payment cuts make it impossible for physicians to make the significant financial investment needed for health information technology. So the SGR has trapped physicians and policymakers in a vicious cycle. So the AMA asks Congress to ensure that physicians also are treated like hospitals and other providers whose payment updates keep pace with the medical inflation. And we again urge Congress to take immediate action to avert the July 1 cut, replace it with 18 months of positive physician payment updates that reflect increases in medical practice costs. This will allow time to repeal the SGR.